Hello, everyone. Welcome to Neighbor Care Health's Community Chat. My name is Sharice Jones. I'm the Director of Homeless Services and Clinical Operations with Neighbor Care Health. And here we have John Kim from Healthier Here. Welcome.
Thank you. So nice to be here. My name is John Kim. I'm the CEO of Healthier Here. And I have to say that it is delightful to be back with Neighbor Care. We go back way, way far, all the way back to the capital campaign for the Meridian Center, where we saw the vision for integrated care and actually designing space to accommodate that style of practice come into reality. And I've been fortunate to have worked for the Pacific Hospital Preservation and Development Authority, and now Healthier Here, both organizations that are investing resources into the community to promote health equity, and of course, the work of Neighbor Care. So thank you, and it's great to be here.
Yes, and thank you for being here. All right, so how do you define whole person integrated care?
Well, that's a biggie. That's a biggie, and it's a mouthful. But I think, if you look at it on a continuum, I think it really helps to place it sort of where it makes sense. And that is, there is a style of care that is just siloed, where each provider is focused only on a narrow view of what it is that they're required to treat, and it might be driven by how they're reimbursed, it might be driven by their specialty, there's a lot of factors, but in any case, it's siloed. And then as you travel the continuum toward, I think the opposite end looks like integrated care. And a simple way for me to conceptualize it is that each provider to a person knows what the other providers are providing for that person. And it becomes like a circle of a team. And everyone has got the patient in the center. And that's really where the focus is. And the integration happens in a kind of a seamless hub around the person. And then along the way, there's also collaborative care, there's coordinated care, there's whole different variety of combinations where there's teaming, there's sharing, there's a whole variety of different ways. And I think there's room for all of them in different doses and, in different circumstances. How about you?
Yeah, so you bring up a good point when you mention siloed. And that's one thing I would say Neighbor Care Health, we're really working on just that community-based healthcare and having zero disparities and access, right? Removing barriers for folks to have 100% access to care. And so with both of our organizations, I think we can be a powerhouse, right? In Seattle, King County. But to your point is, specifically for me thinking about the last few years when the pandemic hit, kind of how did our community change? And how are we as community members and folks who are professionals in this career path, how are we meeting our community where they are? And so the integrated services, you have to focus on your mental health and physical health, but how are we doing that as a collective? And so I definitely like your approach, and I think we're just getting started. So continue with ideas and continue conversations, but I would just say, here we go.
Absolutely.
Here we go.
Well, I love that you are thinking about it in terms of, the straight and simple term care. And when we talk about silos, one of the biggest challenges that I just see right now is that somehow social care is being treated differently from healthcare. But the dependencies between these systems in terms of impacting someone's life are quite varied and numerous. And, just a simple reality of I'm a diabetic. And for me, I'm not on insulin, but my dad was.
Mm.
And when I think about someone who is housing insecure,
Mhm.
they don't have a safe place
Mhm.
to call home. They don't have refrigeration. They don't have a refrigerator. They don't have a kitchen. So how would someone like that, if they needed injectable insulin, manage their care? And so this idea of not being able to manage chronic disease
Mhm.
because you don't have a safe place for your medicines, let alone a safe place for yourself,
Mhm.
how is that going to impact your health? And there's so many examples, right? But that's just a one that's very acute to me because um, I know how reliant you become on a medication like insulin if you're diabetic, and to not have a way to secure that safely and appropriately means that that's not an option for you.
Yep.
And how do you address that barrier?
Right, right. And as you said, the access as well. And recently on the news, how we've been hearing about the insulin's backlog because of this weight loss journey that is happening. And so folks who actually really need the insulin don't have access to it. So we are seeing a trickle down effect of folks getting sicker and sicker, and especially those who have housing insecurities, right? I will speak to currently in Neighbor Care, I do oversee our homeless outreach program, and we see this every day when we go and meet folks where they are, provide wound care and on-site harm reduction care, but overall, there more care needs to be done to keep folks alive. And that is something that I struggle with every day in my work because we see someone and we say, okay, we're here to do basic wound care or basic, we can refer you somewhere, but we can't treat the whole person. And so trying to figure out how we can do that as a community, it's not just Neighbor Care, but how can we all partner within King County and Seattle to do this as one? And so more to come. I want more conversation around that. That is definitely my heart in working with the unhoused community. And so let's talk more.
Yeah, well, one thing I'll just say is we're right now deep in the process of developing a backbone, uh, a structure to support a network of community providers, community organizations that are serving people who need case management to navigate from healthcare systems within healthcare systems out to social care systems.
Mhm.
And uh, the notion of being able to bring people together as a network and to support the whole thing is really appealing to me because it's not like the work isn't being done. It is being done, but against such terrible uh, barriers. The funding is inconsistent. Um, the workforce is we've
Burnout.
got real issues with
Burnout.
workforce, burnout, and
Yeah.
then just finding people in the pipeline
Yeah.
who want to move into these professions.
Mhm.
Um, and then just the kind of uh, cultural knowledge, speaking the language, trusted relationships so that, people aren't afraid to accept the help and they know that that their case manager is going to be sensitive to what their specific needs are. Um, I think the possibilities are wonderful to stand up something like this to help community providers that are already in place. But the trick is sustainability,
Yes,
right? How do we convert that into something that will stay?
yes. And you brought up a good point around just cultural competence and making sure that we, in the community that we are providing services in, how are we meeting those community members? Does our staff reflect the population and patients that we are seeing? And I will say, here at Neighbor Care, I've been here almost a year, and there's been a tremendous shift in leadership. I was the first Black DCO in this role, and so That's powerful for me, and powerful that I can use my platform and my advocacy to show, okay, someone who looks like me can be sitting in the seat that I am. And so with that being said, I will say that there's been history around healthcare and people of color and the white coat syndrome. And for me, that is very prevalent, especially when COVID hit. And, I don't know if folks were working at the time or in specific fields that you had to get a vaccine to continue to work. And we saw a lot of layoffs happen and a lot of folks needing to quit and leave their jobs. And most of those individuals were people of color because vaccine. There's a whole history on that, but we won't get into right now. But just saying, meeting folks where they're at and making sure that we identify the community that we are serving. And you also brought up a good point. I will say, I also oversee our school-based clinical centers within the Seattle School District. We have 15 clinics within the Seattle School District, ranging from elementary, middle school, and high school. And within those clinics, we have regular primary care services, mental health services, dental services, and we have some health education services as well. And so we see the kiddos have access to mental health, right? Or having access to medical services and dental services that they possibly wouldn't be getting outside of school, because we know, parents and have to take off half a day
Yeah.
to transport their child to a dental appointment or a medical appointment. But we can see the kiddos during the school day. We don't have to pull them out of school. And also it just gets them in the regular habit of, okay, it's okay to go to the doctor. It's okay to seek mental health. It's okay to, get your teeth cleaned and approaching it in a gentle way, right? And so that's part of like our integrated care as well. And just saying it's okay to utilize these resources.
Wow, that's a ton. Um, I love that meet people where they are is a phrase that really applies to so much of your work and the way that you think about work. And because we share that too. From our position, we believe that equity looks like meeting people where they're at, because everyone has a different starting point, everyone has a different status. And for a system to demand that everyone appear exactly the same to receive the same service really doesn't honor the ways in which we are unique and the ways that we are interacting. I think we take that a step further, and achieving the goal of meeting people where they're at also has to be done in a way that's equitable. And we call that nothing about us without us, or nothing without us. And I think the two of those together really are a potent combination for ensuring that our communities have say
Yes.
in what
Yes.
is actually being decided
Yes.
about how they get their treatment, how they get their services.
Yep.
Who knows better, right? And that's something that I'm sure that you have a great deal of experience with.
Yes, yes. And, with the patient input or client input, it makes the work a lot easier because you're not forcing someone to do or go to this place and this place. It's okay, how can we address this together? Here are your options, and then also let them know, but if you don't do this in the long term, these are, this is what things can cause. So I really love that approach, and I feel like we're more successful with patients coming to their well checks and following up and reaching out when something doesn't feel right. And so that's that trust and that relationship building piece that is slowly but surely getting down the path that we need to go.
Yeah, and I'll just say, there's a theme that I think that you raised earlier that I just want to hit on as well, which is ain't none of us gonna do this alone. Um,
Yes.
yeah, we gotta reach out, and, you know, it's like, I don't need to be doing what you're doing.
Yep.
But I need you to be doing what you're doing.
Yep.
And I need to do what I need to do, you know, my work. But when we have awareness and we know what's happening in each one of our spheres, that becomes stronger. And, you know, I really look forward to having more conversations about, you know, how we can each play to our strengths and then create a bond so that nothing passes in between. And then we can start working on the people to the, you know, the other side,
Yeah.
right? And slowly build that, that collective.
Yes, this is not a competition. So yeah, the more we are together, the better. Definitely agree. Definitely agree.
It's funny, I tell a story, and this is one that some of my old colleagues at PHPDA got tired of hearing me say, but I'm gonna say it again. You know, there's an old riddle. How do you eat an elephant? And the old answer is one bite at a time. And I think that really is a lovely idea of, hey, if it seems like it's too big or unapproachable, when you break it down into smaller bites, right, then it becomes imaginable. But I was thinking, man, I'm a hungry guy. I have a big appetite, but it ain't that big. It's not that big. So still not going to eat the elephant, even if it's broken down into small bites. And that's when I realized the answer has to be invite everyone to the table and then together eat it one bite at a time. And I think that really kind of speaks to this whole notion that we all have our part to do. Some are upstream, some are downstream, some are both. But I think it's going to take all of us.
And it's the beginning of breaking down the silos.
Yeah.
Yeah.
What are you most excited about in terms of what's coming up? Like, let's say if we're just looking at the next, like this summer, what's exciting for you?
So what's coming next over for Neighbor Care? We're getting into the Making Care Primary, which is about a 10.5 year plan. We're going to start piloting on specific population who Medicare benefits. And so really focusing on the population of, you know, doing the well checks and just meeting their needs. And so piloting for the first couple of years, figuring out the systems, and then bringing it to a larger organization and hopefully larger community. But I'm excited because really this shows like the integrated care, and really it's a holistic approach of partnering with the patient in their care. And so I'm just excited for that because this will be intentional, even though we are doing it, but this will be intentional and we will be able to track the data and better outcomes and hopefully be the pillar in our community for others to seek and reach out.
So are there other organizations within our region that are participating in this, you know, for the state of Washington?
I want to say yes. I know we just got on our award because we applied in the fall, but believe more information is available online. And yeah, so we can definitely partner with other folks, but across the nation too, because we can see what someone in New Jersey doing than the West Coast, right? We all have different ways to approach things, but that collaboration and cohort is helpful.
I think so. And my reason for asking is, so Healthier Here is really focused on system transformation. I mean, there are partner organizations that we support and that we are, you know, fortunate to call brands who are really downstream. And they're like really taking care of the most urgent needs and have little capacity to actually be trying to transform that energy into systems change because they're just like
Just go, go, go.
every day, go, go, go. And so as we think about what it's going to take to make the system change so that everybody downstream can take a breath, because the system now is addressing some aspect of what it is that they have to do, is that it quickly moves up the chain, because we can make a change in a policy here on the ground. But if at the state level, there isn't change, and it might be legislative, it might be policy, It might be a regulation, but if it doesn't happen there, then we don't see the benefit down in our local jurisdiction. And then sometimes it's even as far as federal.
Yeah, yeah.
So this idea of being in concert with other providers doing this, it feels like it's at once bigger and perhaps a better demonstration.
Oh, yes, and we're removed from the bottleneck.
Yeah.
Yes, the larger systems change. I'm excited to start the process and the project and to keep folks updated about what's happening.
That's wonderful.
Yeah.
I'm curious, I know that as a federally qualified community health center, FQH. like that?
FQHC, yeah.
That, you know, there was a lot of excitement around patient-centered medical home, or the notion, right, that at least mental health, physical health, and dental,
Mhm.
like, really needed to be threaded together. How has that been from sort of on the clinical side of that?
Yeah, so I will use example from the school-based health center clinics. We have weekly consultations and just really talk about that holistic approach and care. And there's consults about, okay, here's a patient and this is going on, let's pull in this wraparound service. Let's all get together and work with the patients. And I'm talking about school-based healthcare. So we're working with the parents as well. So everyone is involved, wraparound services, and say, okay, maybe there's an issue with X, Y, and Z. This is our recommendation on how to approach. Let us know what you want to do, possibly. And also being able to give education to the parents around this is what it is. And a lot of the individuals who we do see in the schools, some of them are newer to United States, no insurance, things of that sort. So it's a lot of resources that we pull in around just education and just providing conversation around, hey, we see this is how we would like to move forward, but we would like you to, you know, be included into the decision making. And so far, like I said, I've only been here almost a year, but so far, that conversation and that approach is working. And it's meeting the patients where they are at.
Yeah, and you know, the other thing, where they're at isn't just geographic, it's not just a location. Timing, right?
Mhm.
Not only where they're at, but when they're ready.
When they're ready, that headspace,
Yeah.
mental space, yep. Emotional, it takes a lot to even pick up the phone and make an appointment to get your teeth looked at.
Mhm.
A lot to pick up the phone and make an appointment to say, hey, something's going on, I need mental health services. So, yeah.
You know, there's gotta be challenges that you're facing with regards to beginning mental health services with someone in like a school-based clinic where it's better suited for episodic, right? Not the continuing care. I mean, a dental, it's like you show up, you get your clean, you don't need to be clean for another, what, 6 months, right? But with mental health, behavioral health, right?
Mhm.
This, once you identify the need and let's say you're able to get it started, there's this need for continuation. What are some of the challenges that you see in, you know, staying with that service, even though it may have started in a fairly simple episode at school?
Yeah, so actually, we're being requested to add more mental health services in the Seattle School District schools that we're in. We're not in all of the 15 sites that we offer neighbor care services. However, since the pandemic, we're seeing a lot, and I just had a conversation yesterday with the mental health therapist in elementary. There's wait lists in elementary. And principals are reaching out saying, hey, can we get another therapist? Can we get this? And funding is number one because the mental health side of things is fairly new to us the last few years. And so since the pandemic, we've been seeing more and more, and unfortunately, suicide ideation thoughts in younger and younger folks. Actually have patients as early as kindergarten, 5 years old. So there has not been a resistance. There's been actually an ask for
Mhm.
more. Yeah. So this was the first, that like the last 6 months that I've been hearing, we need more, we need more. And then there's wait lists, there's wait lists. And so we try to, see and take as many, kiddos that we can, but also like referring out if need be.
It must be so different in comparing what it's like working in the elementary school setting versus high school.
Oh, yeah.
You span, right, elementary, middle,
And
and
high
high
school.
school. Once they're in high school, they're achieving the age where they no longer necessarily have to share information with their
Yep.
parents.
Mhm.
Do you find that that's creating kind of interesting challenges?
I wouldn't say it's a challenge. I would say that we're seeing more and more middle and high school because you have to be age 13.
Yeah.
You don't have to, yeah, so we do confidential services. And so we also run groups and especially high school too. And and it's been very successful and I would say consistent with reoccurring appointments. And then this team has been consistent. So when the kiddos come to the appointment or reach out, they know that they're gonna see Miss Johnson.
Yeah.
They know someone's gonna be there on Tuesday at 8 a.m. coming to the teen center. Because we do have like high school, middle school, a lot of walk-ins, high school is a little bit more freer. And then we do have our front desk staff, the health coordinators, who they're the face of, the first face that they meet. And so welcoming face, familiar with, students, they know, Stacy's gonna be at the front. Hey, Stacy, I just wanna come in and say hi. And then that's when the front desk person can say, well, hey, John, I noticed you missed your appointment last week. I haven't seen you. You want to come and see, she's here right now. So just casual communication, a lot, it's not standard for like we'll have appointments, but
Right.
a lot of time we are open to the walk-ins because we know that's kind of the high school, middle school. Like
Well, that's kind of the important thing to remember, that it's relations.
it's relations, yep.
Yeah, I mean, it's not a robot delivering care and it's not a system delivering care, it's a person.
And it's also a safe space. It's also a safe space for kiddos to come and know that they can talk to someone
Mhm.
and that person will be there.
I try to tell my kids that all the time and they just don't take me up on it. Can't figure out why.
Yeah.
They would rather talk to anyone else.
Someone else, yep, and they know it's confidential and, some things, have to be shared, if it's alarming, but, yeah.
So this must be so successful that government and insurance companies and folks are just like dying to pay for this. All of it.
Yes, yes.
Um,
Well, Neighbor Care is, actually, we are the leaders of school-based curriculum. So, we have the largest school-based centers in King County. We have 15 in the Seattle School District and one Vashon Island.
That's a lot of responsibility.
But it's fun.
I bet. Well, it feels like important things are happening when you're able to see, a middle school student, come back from the edge.
Yes.
My, I have personal experience with kids getting bullied in school and to not feel safe and to always be worried and then, not knowing what to do as a parent, not only in terms of like how to deal with the system that, in which this was occurring, but also just taking care of your own kid. So, to know,
Mhm.
right, that the resources is there and it's easy to access and
Yeah.
that's fantastic.
So we have a question. What would Neighbor Care do with additional funding to better self-community that you mentioned? Well, with additional funding, for me, I would say I would be able to hire more staff and provide more resources, especially to those who are unhoused or unstably housed, just because of some of the funding that we do receive, we are restricted to specific things that we can spend on. And so if we do receive additional funding that is less restrictive or unrestricted, I definitely would love to build capacity, hire more staff, get more boots on the ground, and provide more resources for individuals.
That's a great question and a great answer. And it's funny, it kind of raises an interesting thought about funding. Not all funding is equal. And, you kind of mentioned it. It's like, if you get really narrow restricted funding, that's not the same as getting capacity building funding or general ops funding, the kind of thing that gives you flexibility to actually put the money to where it's needed the most. And the other thing, I guess, is to set up a funding stream that's 1 year in and out.
Oh, yeah.
With
Sustainability.
high requirements on reporting and data.
Data.
Yeah, those types of things. It really makes it challenging sometimes to take that additional funding, even though that is something that you would need. So not all funding is the same, right? So multi-year funding, some flexibility in what the funds can be used for, and a lot of trust instead of like a lot of requirements.
Yes, and reporting.
Here we go. Here's a question. As a funder and an organization working to ship systems, what can other funders learn from you, and how can Healthier Here support organizations like NeighborCare? Ooh, that's multiple questions.
I can start from the beginning.
Oops.
When it comes to funders, I love just the relationship connection. Meeting with the individuals doing the groundwork, understanding, hearing the stories that we deal with every day. And prior to either like writing a grant application for us to apply to, we'll have conversations about, okay, what have you been doing? What works? Where are restrictions? How are you having a hard time with either spending down dollars? Why are staff burning out? And what more could happen? A couple of repayment options or reimbursement options that we currently do have with our grants. One is a performance-based reimbursement. And so we have to meet a threshold of serving X amount of individuals for the quarter, or else we don't get reimbursed our full amount. So if we only serve 75% of what we're supposed to do for that quarter, we'll only get reimbursed a certain amount. So we're not getting our total dollars. And that is a bottleneck approach, and it, at the end of the day, was not sustainable. And it also burnout, because we're trying to stress, meet the numbers. And that's not my approach. I don't want to just meet the numbers. I need to make sure even if I worked with one client for 6 months, that's one client because, hey, it took me 6 months to get them in the door to get an ID. So then they can go get housing, get food stamps, get X, Y, and Z. So I just really want funders to come down to our level and boots on the ground, meet folks who are doing the direct work, have conversations.
That is great advice. I don't think you can imagine how challenging it is to even establish that relationship so that care can happen. And, you sit in somewhere removed, and, you're behind a desk and a computer, and you don't have that reality check. And so seeing it up front and really being able to experience it, I think sounds like a great thing. And that's something that, we will definitely hear. I would say that from Healthier Here's perspective, things have changed for us over the course of the years. In the early days, we were able to spend money on testing out innovations, trying new practices, helping to sort of put ideas out there, test them, see how they, whether they produce value and those types of things. And because we have such a heavy reliance on sort of our relationship with the Medicaid transformation waiver, our work and our spending is shifting more toward building a community hub to provide case management for folks. But one of the things that we learned along the way, and this is with an eye towards system transformation, is that community-based organizations are really in a place to see from community members what the real need is. And if they are stronger and if they're more capable in terms of being able to provide services and to really help bring the narratives up, there is nothing like authentic voice.
Community voice.
Community voice.
Yes.
And if you want systems to change, then I think bringing those stories forward and helping the community find its strength. Actually, they find their strength every single day, but taking that strength and amplifying it into different spaces where decision makers need more input and they need to hear from those who are closest to the issues. Trying to find ways to fund those efforts, I think, always going to be worthwhile. I did mention, the hub, and one of the things that I do want to emphasize is, again, this idea that we can't do it alone, right? And so instead of Healthier Here creating a whole new structure that's going to be duplicative of what's already happened, like the work is so good that's happening. So how to connect that in ways that make it stronger, how to support it with technology, how to bring contracts and regular funding and make investments into workforce, to do those kinds of things is a value add to the organizations that are already in space and who are already working so hard and providing such great services. So I would say that when we launch, when we get to go ahead to launch, we're going to be starting small, and then we're going to need to grow the network. And so we're going to be out there looking for ways to partner with folks that are serving individuals who have both the need for healthcare services and social care services, because that's the gap. Where I think we can make the biggest difference. And hopefully, with a strong network of organizations who are either doing case management already or who provide services from the social determinants of health space, we're going to want to try to partner up and find ways to link that up and make it a stronger network.
Yes, I like that. And my question for you around that, how are you determining what organizations that you will work with, but also how are we uplifting even larger organizations? How are we helping uplift those grassroots, smaller organizations who are either Black or Brown led and who have the less experience with getting funding, where to be in the room or what table they need to sit at? Because what I'm seeing a lot is we have these grassroots organizations who do an amazing work, small outreach, but they don't have other opportunities such as larger known organizations in the community.
Yeah, that's a great question. So at Healthier Here, the number one value is equity. And one of the ways in which equity lives with us is that we do need to look beyond the regular names of folks who are highly organized and well-funded. And part of what we see is that the smaller grassroots organizations that may not have as much history or as much infrastructure or funding are reaching populations that nobody else is reaching. So one of the ways that we're going to look at this is, are we getting coverage? Like, are we really hitting the communities that are most in need. And if the big ones, for instance, are really good at hitting this one, but nobody's hitting this one, then we're gonna need to find those organizations. And if they are not as well funded, then we need to help them. If they're not as well equipped, we need to help equip them. So we want to invest in infrastructure, capacity building, technical assistance, those kinds of things. So there is a little bit of urgency around time. So we're going to start with a cohort of folks that are ready to go. And that's going to provide some coverage, but not all coverage. And then what's going to happen is as the hub operates, we're going to start seeing where the gaps are showing up. And then we're going to have to open it up for additional cohorts, and we're going to need to really do some reaching out. I fully suspect that there are going to be some difficult to reach populations that there may not even be an organization that's existing today that's serving them. And so we're going to be doing this for the next 5 years. And so there's going to be time.
Yeah. I would love to see even the well-known and larger organizations who do have the funding and infrastructure help uplift those small grassroots organizations.
I think by setting the example around good partnering and really recognizing the value of all shapes and sizes, I think that's something that we want to keep doing and encourage others to do as well. That's, it's interesting. We were having a conversation about, what does it truly mean for, these smaller buy-in for organizations to be able to come in and sit in our committees and sit on our boards, because we do make a concerted effort to reach out. And, we know that it's working well if they're able to say, we felt like we had an equal seat at the table, because they're rubbing elbows with hospital executives and, managed care organizations, CEOs, and, people who are quite powerful and, in the mainstream structures. But for them to feel like their voice is heard and that the facilitation is happening where, people feel like they actually have a meaningful seat at the table is something that we strive for all the time.
Awesome. I look forward to hearing more.
Yeah, we got more to talk about.
Seeing more. Yes. All right. Well, thank you so much for joining myself and John. And I want to send out a last plug. We have 2 more community chats. This is our spring give. Please, if you want to continue conversations, reach out, but also please donate time, effort, whatever you can, participate in the board. We would love to show your appreciation. And again, I just want to say thank you for chatting with us. And we've had a good time. And if you have further questions, please reach out. Thank you.
And thank you.
Yes, thank you for being here.